All right, obesity. Not a topic that's near and dear to my heart to discuss. It's for personal reasons. Being overweight is something that I have dealt with most, if not all, of my life. I could ask myself lots of questions as to when I know all the answers, why don't I follow them? And I think I have, and I think I don't have an answer. So when I think about this whole textbook, this whole idea of health psychology, I think about what a struggle it is. How do they get people to really make that change? Sometimes I make changes and then I stop, and then I make changes and I stop. And I wonder why I did, because I know why not? And I know I'm getting personal here. Some of you might be uncomfortable with being too personal, but I think it'd be hypocritical if I didn't address it. I mean, it's one of the reasons I almost said I would not teach this class, because I didn't feel like if I could say I was healthy in a lot of senses of the word, then should I be talking about health psychology? But then I thought about the broad, the 100 different ways one could be healthy, and I feel like I check most of them successfully. I mean, maybe I'm kidding myself there too, but assuming I am correct, and this is one area that I'm not, I can survive that and talk about it from kind of my perspective. So if it is maybe offensive, if I say something offensive, and I don't know if I will or not, but I think I'm talking about it as a personal struggle. So since I'm kind of living it, I can talk about it. So some musings about obesity, some things that I feel like are missing from the chapter. Whenever, just a few things to discuss, consider. Whenever they've gone through I've gone through the chapter, the psychosocial discussion, and I see this in a lot of discussions about obesity, nobody ever wants to say all the reasons, as far as I can tell. They don't say, and again, I'm not saying any of these as excuses, because we can all make choices, and those who don't just don't for whatever reason. I've wondered, like I said, many times why, but again, these reasons exist, but they're not excuses. But one reason I would say is, you know, jobs have changed so much to where people are so much more sedentary, and we keep creating machines that do things for us, so we have less and less reason to move around. They keep trying to create cars that'll think and do everything for us. Just machines around the house to do everything for us. We don't have to work as hard. Again, we could keep doing that, but there is a tendency to stop doing it if things are doing it for you. In our society, it's been well documented that there is less recess and play planned in public schools. That's where kids are, sort of that practice ground of what should they be doing. If time is getting cut from the school day so that they can study harder to pass standardized exams to keep up with other countries, then things like recess and play are the first to go. I mean, besides music and theater and, art and anything like that. To cram in further learning, which means you're sitting in the chair more. Now, that's not the whole reason either, but that does play a role. That's something we talk about a lot in developmental psychology. And then, of course, electronics, and you can't really help it. But I mean, I know so many children, well, so many every age really, but if we're talking about children who are going to grow up and not have good eating habits and weight habits, people who are glued to their tablets or their phones nonstop. They come home from school and they go to their room and they do something video game related, and the only time they saw the outdoors was walking from the bus to their front door. So it's a mindset change, and once you've done it over and over, and everybody in the family's doing it, there's no role model to decide otherwise. And of course, I can't even claim any of that, me personally. Electronic games weren't even really that big of a deal when I was a child. But nevertheless, we're talking about sort of going back and forth between then and now, and it still all seems to be an issue. But those are things I did not see mentioned in your chapter, and I never do see mentioned in the book, so I felt obligated to say them. The BMI chart. There's off and on. There's controversy about, is it a fair expectation of weight and height comparisons. I don't know the definition. I don't know the answer to that, but I thought I would bring it up. They sort of just provide it as law. This is what has been determined, and not always has it been discussed that those comparison figures are reasonable for everybody. But there again, that's up for debate. Recently, there was a Kelly Clarkson. I think she had a baby or something, or she's come back to sing or something. Anyway, there was quite a bit of fat shaming, and that is not a word I would ever use, but it has become a real thing. Fat shaming people, and there were just lots of people talking about her for having gained some noticeable weight. And that seems to be more and more of a discussion. There were plenty of people on television discussing how mean it was that person discussed her weight, but none of that had ever really been the case before, and now it is kind of taking over our national discussion. It seems like only a short time until that's kind of a normal thing, and then we'll have to see what do we think about that, and how can that be helpful? I mean, shaming would never be helpful, but how can these ideas be used to be helpful, or would they never be helpful? The DSM, I was just going to mention that in the new DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, obesity had been discussed as being added into the chapter with eating disorders, but ultimately it didn't make it. It was considered more of an environmental, physical thing. I'm not so sure that didn't make sense, that it would have been included. It's not like the other eating disorders, but it seemed like it could have been in that category. But anyway, it was a discussion. Gastric surgery has evaluations, and then procedures are on the rise, for better or worse. Those are things where people decide that they need to have something done to cut out part of their stomach, or something wrap around their stomach so they can eat less and feel full sooner. Usually these people discuss having had years and years of no luck losing weight. Now, who knows how hard they tried, but there is that on the rise that is becoming more and more mainstream. And then just the plate versus the pyramid. There's a video on Moodle that talks about the My Plate, showing the sizes and the amounts of food that would be on your plate, instead of the pyramid, which people may or may not have misunderstood. I mean, that's one of the reasons given for why they had to shift from the pyramid to the plate, that people misunderstood that the top level wasn't more important than the bottom level, although that was about oils and fats, and I can't believe people were confused that would be better than, fruits and vegetables, but who knows? Anyway, so plate versus pyramid is a thing. It's a discussion. Just really briefly, diet and disease. I mean, I think it goes without saying that it's common knowledge that there is a link. Overweight and obesity usually connected to the idea that those would be because of more intake of various types of fats. I guess it's not necessarily exactly always the same, but those would go hand in hand for the most part. Raises risk of coronary heart disease, cancer, multiple chronic conditions. That would be cancer, heart disease, mixed with other things, hypertension, diabetes, so on and so forth. So then the question is, why doesn't a health psychologist have an easy job of convincing people to stop? And I think that is kind of the forever question. Why would you hear that and then think, oh, I agree with all that I don't want it, it's all bad, but I continue to do it. So why would somebody say that? Why would somebody say, oh, I agree that smoking is, blackening my lungs, or going to make me have to breathe out of a stoma, and go on one of those PSA commercials to tell us about it one day? There's no clear answer. Denial, choosing not to beliefs in yourself in different ways. It would be a whole discussion to really talk about that I think we're a few years away from, but I can see public service announcements sooner than later for obesity following those for different drug addictions and cigarette addictions. Really briefly, the biopsychosocial model of obesity, there's a section on that in your chapter. Basically, just to remind you that there are biological factors, there are psychological factors, and there are social factors that feed into why someone would become obese. And I noticed my poor choice of words there, feed into. So those three arrows, sort of point to the box that equals obesity, and then you think, what all led to it? Well, obviously, in every single person's life, they would be slightly different, but just to remember that it would never be one thing, and none of these are unto themselves reasons or excuses. But there has been research that shows that genes do play a role in who becomes obese and who does not. But that, of course, is in no way the only thing. That's one thing that's hurt the discussion of obesity, is when someone who is obese says, well, I can't help it because my genes make me fat. And that is not exactly fair in most cases to base your reasoning on. Because the psychosocial environment has a lot in it. The role models of your parents, the types of foods that you had available to you throughout your life, the habits you formed, all of those can be stopped. But I mean, they are hard to stop, and people don't necessarily always stop them. So they do play a role. So environment and genetic, both of those together. Then there's stress in people's lives. So people stress eat. I mean, some people stress work out, and that's become its own discussion of like a little subtype of eating disorders. It's like, I can't even think of the word, but it's workout, anorexia, where you work out and work out and work out and work out, and then you're not healthy. So this is sort of the flip side of that. I've had a stressful day, I deserve that, that Hostess cupcake or whatever. Certainly, it's not, I deserve that kale chip. That is not a comfort for a lot of people. And then, as I said a while ago, the prevalence of sedentary jobs and lifestyles, and then abundance of processed food that's handy and available in fast food restaurants and so forth, that are all putting their money out there to advertise to you because they need you and want you. And then your book talks about links between those who are less educated and have lower income, lower socioeconomic status. It says here, the risk factors include more limited access. People who are less educated and have lower socioeconomic status have been linked for these reasons, that they might have limited access to healthcare services, less knowledge about the importance of a healthy diet and the hazards of obesity, lower perceived self-efficacy in being able to increase their fruit and vegetable intake, and less exercise. Now, again, all of that is partially true, and all of that is partially, I'm not sure we could say that people didn't know. Are we really going to say that in our current society people didn't know that large pack of processed bologna would eventually be bad for you? Seems a little hard to believe, but I suppose that could be a possibility. It would be a partial possibility mixed in with a bunch of other partials. The not access to actual fruit and vegetables for low income people who live within poor areas of cities, as the book discusses. I can see some of that. And then less exercise then you ask, is that a choice or is that a necessity in a difficult neighborhood? There are all kinds of things to consider. But a couple things they mention here, that to combat this, public health policy interventions, and then city changes that would lead to thinking about cities in different ways with bike paths instead of always needing to be planned so that you'd have to drive everywhere to get everything, and then you're already in your car, making it more likely to go through drive-thrus and so forth. So it's such a topic that a lot of people just want to say, well, just get up and exercise and eat right and stop it. And yet that does seem like it makes sense, and yet there does seem like there's a lot more to it. So there's your thoughts for the day on that.